In recent months, the drug finasteride has been getting some attention within the hair loss community as a topical issue for discussion amongst industry peers and men concerned about the potential side effects it's rumoured to have caused. So much so that in April 2012, the FDA, that's the US Food and Drug Administration, has announced label changes for the drugs propecia and prostate that contain finasteride, saying they could cause sexual side effects in men that take them. In an official statement by the FDA, they said, despite the fact that clear causal links between finasteride and sexually adverse effects have not been established, the cases suggest a broader range of adverse effects than previously reported in patients taking these drugs. So we felt the issue was something worth discussing further, and in this video we're going to share more information about finasteride and the idea of these sexually adverse side effects. It's still a fact that the links between finasteride and sexual side effects have not been established, and this is even recognised by the FDA in their statement. Finasteride is widely known in the industry as one of the most effective drugs for treating hair loss, and its discovery was originally made by accident as a side effect of finasteride being used for treating enlarged prostates. It's been used since 1994, and it's helped millions of men around the world grow more hair in response to male pattern baldness. And since 1994, when the drug became widely used throughout the industry, many studies have been made on the effectiveness of finasteride in treating baldness. And the alleged side effect of sexual dysfunction has hardly been mentioned until recent years through anecdotal reports in the press and on the internet. In studies done with finasteride and a placebo to test the links, 3.8% of men using the drug claimed to have had one or more sexually adverse events, and 2.1% of men using the placebo claimed the same thing. There's a difference of only 1.7% of men using the drug that claimed to have experienced some form of sexually adverse event as a direct effect of using the drug from this study. These are very small numbers, and when compared to the overall success rate of people using finasteride to treat their baldness, it seems insignificant when comparing the benefits versus the perceived risk of this treatment. In a study done with over 3,000 men over 3.5 years, finasteride maintained a response rate for regrowing hair of over 80%, even after a 2-year period. The response rate even improved with increasing duration of treatment. And in another study with 113 patients, 86% of them benefited from treatment. Now, it's worth drawing your attention to the fact that an effective hair loss solution doesn't rely 100% on finasteride. It should incorporate a number of treatments to address your specific needs. It's only part of your solution. It's also worth noting that any drug you take comes with side effects that need to be mentioned. Have you ever researched the side effects of taking Panadol? At Ashley & Martin, we recommend the most effective forms of treatment for hair loss, and finasteride is a very effective drug to be considered as part of your overall treatment if appropriate. To get a professional medical recommendation on your specific hair loss treatment, make a booking for a free consultation in one of the many Ashley & Martin medical hair centres located around Australia, New Zealand and Singapore.